Does your loved one have chronic pain or significant pain and they have a wound? This is something I encounter in my practice, which I'm going to help you with today. I'm Bienstock. I'm a board-certified plastic and reconstructive surgeon. My expertise and specialty is wound care for those that are homebound and bedbound. And I'm here to help you and your loved one regarding issues of chronic pain. So it's not uncommon that patients, when they come homebound or bedbound, they have wounds and they have chronic pain. A lot of these patients are put on Tylenol or narcotics such as oxycodone, which generally don't work. Chronic pain is a really difficult issue to manage, even in patients that don't have a wound. I get very frustrated with some of the primary care providers that really don't address chronic pain. It's pain in general in the United States, as well as internationally, is a very difficult issue to deal with in the geriatric population, particularly those that are homebound and bedbound. These patients really can't get out to see an expert such as a pain management physician. My first recommendation, if they can get out, is to see a pain management doctor. There's different things that can be done, altering the cocktail of medications. I'm not a big fan, as everyone knows, of tramadol and other narcotics, even though sometimes I do recommend this after post-procedure. It just doesn't address the long-term issues. Sometimes stroke patients, they have chronic pain or what's called neuropathic pain. They're on something called gabapentin or Lyrica, which does help. Other patients are on a whole slew of other medications. One thing I've seen that's really beneficial in these patients that can't get out to see a pain management doctor and receive blocks is really to look at medical marijuana with a CBD combination. Unfortunately, some of my religious patients are not gung-ho about this, but there's no religious doctrine that prevents them from getting medical marijuana, as well as CBD. It really helps with pain, and that doesn't eliminate pain. I don't want to sell something that doesn't happen, but I've had patients that have had significant stroke pain, and it's able to decrease and curb the amount of pain medication they're on by having medical marijuana. It obviously helps with anxiety, mood, as well as appetite. It's not addictive, but people think it's addictive. You don't smoke this. A lot of the medical marijuana can come in gummy form, liquid form, or under the tongue, which is called sublingual. Other facets that can be used for pain are different treatments such as acupuncture. I mean, there are plenty of providers that can do acupuncture in the home, aromatherapy, acupressure, cupping. These are all things that are more alternative, and there's nothing wrong with them. They're part of Eastern medicine practices. As I said, one of the things I always am conflicted with is dealing with primary care physicians that are not really astute with pain relief, and it becomes very challenging to manage patients who are over 90 that have pain either from the wounds or other issues, and you don't really want to have them on narcotics. So this is an area that really needs to be explored further. I personally tried to push more alternative treatments such as the acupuncture, energy work such as Reiki therapy, as well as medical marijuana. These are not the only strategies, but these are some strategies that will obviate the need for narcotics such as tramadol, Vicodin, and Percocet. If you have any questions or comments below or have suggestions, please leave them. Make sure you subscribe to the channel, and please share the channel when you get a chance. Thank you.